Thank you, Mr. Speaker. Mr. Speaker, it's certainly an honor for me to rise today to participate in this debate on Bill C-442, an act representing the National Lyme Disease Strategy today. I want to begin by commending the member from Saanich Gulf Islands for her stewardship of this important bill, and I want to acknowledge its support by many members in this House. And Mr. Speaker, the honourable member mentioned in her comments the fact that many of us, myself included, live in areas where the black-legged tick or the deer tick is endemic. And many of us, myself included, have constituents who have contacted Lyme disease at some point. So this is an endemic disease. It is a Canadian-wide disease, and it is a disease that is spreading. And for those reasons, Mr. Speaker, we need a national strategy. The support for this bill underscores the need to work together to address the emerging infectious disease in order to minimize risks for Canadians. Across the country, the number of reported cases of Lyme disease has increased significantly in the last decade. In fact, the actual number of cases in Canada is estimated to be up to 3 times higher than reported because many Canadians may not seek a full diagnosis, and quite frankly, Mr. Speaker, many medical professionals don't know how to diagnose Lyme disease. And perhaps to underscore that point, as the honourable member would know, Lyme disease was first reported in Lyme, Connecticut in 1975 or 1974. Here we are 39 years later with Lyme disease very endemic throughout New England, now spread into Canada, following the white-tailed deer, of course, and we still do not have a national strategy for Lyme disease. So I think that underscores the need for this important discussion that we're having here in the House of Commons today. Mr. Speaker, this has led to a growing recognition among governments, health practitioners, and stakeholders that work needs to be done to address this emerging infectious disease. Support for this bill also highlights the need to better leverage efforts at the federal level and across jurisdictions in Lyme disease surveillance and research. Our government has already established improved surveillance specifically aimed at Lyme disease and welcomes the sponsor's efforts to bring additional attention to this important issue. The proposed bill highlights the need for continued action by governments, stakeholders, and the public health and medical communities to improve understanding and awareness of risk factors, prevention, and treatment options. Mr. Speaker, the objectives of this bill are laudable and in fact align with the many activities already being undertaken by our government. Canadians should be reassured that this government has not been standing still. We are already making significant progress under the leadership of the Public Health Agency of Canada. We are working with provincial and territorial health authorities and other partners in informing Canadians of the health risks from contracting Lyme disease. And we also continue to help protect Canadians against Lyme disease through improved surveillance, by conducting research, by providing factual and evidence-based information to Canadians, and by providing support for laboratory diagnosis. Since 2006, our government has invested $4.6 million through the Canadian Institutes for Health Research to specifically fund research on Lyme disease and to disseminate the latest findings and knowledge to the scientific community. Mr. Speaker, these efforts are a central component to the Public Health Agency's approach to infectious diseases in Canada. More specifically, our approach to Lyme disease takes important action to reduce the disease's impact. We do this, Mr. Speaker, by enhancing surveillance, prevention and control, research and diagnosis, and engagement, education, and awareness. These 3 areas are consistent with the key elements of the bill, and our approach is already delivering results. But as mentioned before, we are also prepared to do more, and in a collaborative fashion, to further address this emerging infectious disease.
That is why I want to signal to the House today that the government supports the intent of Bill C-442 and that we will be proposing practical amendments to ensure that the vision and values expressed in the bill can be realized and provide maximum benefit to the Canadian people. The proposed bill addresses an important issue, but needs to be refined to remain consistent with the jurisdictional roles and accountabilities of Canada's federal system of government. In keeping with the spirit of the bill, we must be mindful of our federal role and respect jurisdictional accountabilities. Mr. Speaker, as we know, the provision of health care services in Canada falls under provincial and territorial jurisdiction. It is the provinces and the territories that establish and monitor standards of care for health providers. It is also the purview of relevant medical colleges to define clinical care guidelines. It is not the federal role to tell medical professionals how to practice. The proper role for the federal government in this area is to ensure that best practices are being shared across all jurisdictions so that Canadians can be reassured that treatments are guided by the best scientific evidence. In a similar vein, dictating to provinces and territories how and where to allocate their spending is contrary to our government's approach to fiscal federalism. However, it is within our federal role to facilitate collaboration across jurisdictions and with stakeholders to monitor and address the challenges proposed by Lyme disease. We're doing precisely that through our involvement in the Pan-Canadian Public Health Network and our collaborative work with stakeholders such as the College of Family Physicians of Canada and patient advocacy groups. For example, the Public Health Agency is already working with the College of Family Physicians of Canada to engage health professionals on Lyme disease by increasing awareness amongst healthcare providers to enable them to recognize, diagnose, and treat the disease in its early stages. Suffice to say, while we concur with the bill's goals and objectives, it will need to be amended to reflect these jurisdictional realities, something that the honourable member has already mentioned she's supportive of. This government is looking forward to working with the member from Saanich Gulf Islands who will propose amendments in these areas to ensure the bill is consistent with the provinces and territories' primary role in delivering health care. Mr. Speaker, early on in my speech, I mentioned that it was 39 years ago that Lyme disease was first diagnosed in Lyme, Connecticut. 39 years ago to get to this stage. I've heard some members in this place, as the honourable member from Saanich Gulf Islands has already alluded to, question whether or not they would support this particular piece of legislation. Some members say that Lyme disease is not prevalent in their area, it's not endemic in their area. I would suggest to them, Mr. Speaker, that they better take a look at whether or not they have white-tailed deer in their area or not, quite frankly. The black-legged tick, or the better known in my part of the world as the deer tick, came to North America with the white-tailed deer. It has spread very successfully in most jurisdictions of North America. And as deer become more urban, or perhaps as humans become more rural, and therefore as a result of that, there are more white-tailed deer moving into what are now, were once urban or rural areas, but are now urban areas, this disease is only going to get worse. And it has been wildly, Mr. Speaker, underreported. There are a number of cases that we're still trying to diagnose that I suspect will end up being Lyme disease or some variant of Lyme disease. So in closing, I commend the honourable member from Saanich Gulf Islands for her very important and I think extremely timely work on this file. I know I have a number of constituents in South Shore St. Margaret's in Nova Scotia who are very much watching this file as it proceeds forward. These folks either have contracted Lyme disease themselves or have family members who have contracted Lyme disease. This is a terrible, insidious disease that's very difficult to diagnose, so this is very, very timely legislation. Thank you, Mr. Speaker.